Okay, now we want to look at the human model and look at the blood supply, meaning following the blood vessels. We are starting at the heart with the ascending aorta, which branches right away into the brachiocephalic trunk, which is again just a very short piece, which continues or branches off itself into the right common carotid artery and into the right subclavian artery. Then we follow, coming from the aortic arch, we also have the left common carotid, and by itself coming off the aortic arch is the left subclavian artery. You can see this if I tilt the heart a little bit forward, that we have two branches off the aortic arch here, plus the brachiocephalic trunk. The blood continues then into the descending aorta, going down within the thorax as thoracic aorta. Then we come across the diaphragm, and now we're looking down here, and we can see the first exit of the abdominal aorta is the celiac trunk. The celiac trunk, just above the pancreas, as you can see here, branches into the splenic artery towards the spleen, and to the common hepatic artery towards the liver, which would be situated here. The last and third exit of the celiac trunk is the gastric artery, which is sitting right here. What we also can see below the pancreas is the hepatic portal vein, which brings blood back from the digestive system towards the liver. And parallel to this, we see the superior mesenteric artery. We can see the exit of the superior mesenteric artery also directly here from the aorta. So this is the exit of the superior mesenteric artery. And then on the side to the left renal artery for the left kidney, and we have the right renal artery for the right kidney. Going inferior now in the aorta, the next branching off is the right gonadal and the left gonadal artery. And then further down we find the inferior mesenteric artery supplying blood to the lower area of the digestive system. The aorta further down will branch into the right and left common iliac artery, which by itself will branch into the internal iliac artery and the left external iliac artery. The left external iliac artery is the one who will then exit the abdominal cavity and come into the femoral artery reaching into the leg. The same parallel is on the left side here. You can see maybe the external iliac artery here too. So now when we want to look at the venial blood, following the veins, we are starting within the great saphenous vein, returning blood, and here a little corner of the femoral vein. They combine with and enter into the abdominal cavity via the external iliac vein. The external iliac vein on the left side combines with the left internal iliac vein into the left common iliac vein. The left common iliac vein and the right common iliac vein combine and create the inferior vena cava. Entering the inferior vena cava is the right gonadal vein, and we can see here the right renal vein, where on the left side, the left gonadal vein enters actually into the left renal vein, and then with the left renal vein, this blood will enter the inferior vena cava. And the little piece missing we have here is actually from within the liver, the inferior vena cava, which will sit in like this exactly. But I also want to use the liver to show you that besides the inferior vena cava, we have also a small piece of the hepatic vein, which brings blood from the vein back, from the liver back into the inferior vena cava. In addition, we can see here the common hepatic artery, which came from the celiac trunk. And we also see in purple here the hepatic portal vein, how it enters the liver itself. Then the inferior vena cava will move up through the diaphragm and will enter into the right atrium. Now if I want to look at the venial flow within the upper area, we have the internal jugular, the right internal, and the left internal jugular veins. They combine with the left subclavian into the left brachiocephalic trunk, and on the right side, the right internal jugular and the right subclavian vein combine into the right brachiocephalic vein. Both brachiocephalic vein will enter into the superior vena cava. There is one additional vein entering superior vena cava. It's the azygos vein, which drains the posterior portion of the thorax area. And then, as we know, we have here the pulmonary trunk, which, as you remember, is an artery which enters our lungs. And be careful, these arteries are blue because they have low oxygenated blood, returning blood with the pulmonary veins, which are red in this picture. This summarizes our blood vessels within the human model.